Hey, deserving listeners. Today's episode is a follow-up to the most recent episode, which was a deep dive on empathy. In this follow-up episode, I'm going to read 2 emails from an anonymous patron. And this anonymous patron is a clinician, is a therapist, and also says that they have antisocial personality disorder. They lack empathy. They have psychopathy. And we could use the information we learned in the last episode on empathy to inform my response anyway, to this set of emails. Now, the first email was sent in a while back, and I read it on the air with Bob, and Bob and I responded to it. And then the anonymous patron heard that response and then answered a lot of the questions and elaborated in a second email, which we're going to go over today as well. Okay, so the first email was from anonymous middle tier patron. They wrote in and said, I was diagnosed with antisocial personality disorder some years ago. Fast forward a few years, and I am now a doctoral candidate in a clinical psychology program. I can see how it may be difficult to understand why someone like me would desire to work in this field, especially given my deficits in empathy and remorse, but I am not just my diagnosis. Being in a program has really shown me just how many misconceptions there are in the field regarding people who are similar to myself. I am so frequently subjected to people talking about how treating antisocial personality disorder is not only a pointless endeavor, but also the notion that treating a psychopath is just an exercise in creating a better psychopath. Just chime in here. Yeah, I hear this too at times, that when it comes to people with antisocial personality, or what some people might call a psychopath, these are 2 different constructs, generally speaking, but I might use them interchangeably here because sometimes they are used interchangeably. But anyway, so you'll hear people talk about how you can't treat antisocial personality disorder. You can't treat a psychopath. And you actually should avoid treating people with antisocial personality, because to do so, you're just training them how to be a better psychopath. You're educating them on psychology so that they know how to manipulate therapists in the future, or they know how to manipulate other people in the future. So one could argue, I guess, according to that logic, that it's unethical to society to treat someone with antisocial personality disorder. And I've heard that before. Sometimes I'll hear people say that all personality disorders are untreatable. And I'm guessing you listening right now know that that is not true. But if you step outside of this community of this podcast, there's a lot of people that will say stuff like that, particularly around antisocial and psychopathy. Anyway, going on. And by the way, I'm disheartened, anonymous middle tier patron, reading this again, that in your program, you're hearing it. Okay, going on. I am not going to act like I do not understand why there is this apprehension in the field regarding treating antisocial personality disorder, but I cannot help but look down on my peers and my professors for discussing this population as if I were subhuman, especially when there has been so much research in recent years that clarifies many misconceptions about psychopathy and offers potential treatment options. And then anonymous middle tier patient goes on to to ask questions and that kind of thing. And they also said, I have found that you are one of the few people who discusses antisocial and psychopathic people in an empathetic manner. Yeah. So Bob and I read this email, the longer email, and we responded to it. And I actually don't remember what I said, but I know what my position is, which is that you absolutely can treat people with antisocial. And there's also a spectrum, and there's also a willingness to get help. And I probably, or hopefully, delineated between psychopathy and sadism and Machiavellianism and narcissism, because they're related, they're correlated pretty highly, but they're not the same, and they're not necessarily coinciding in the same person. They're not necessarily comorbid. So one can have antisocial personality disorder, but not be a sadist, meaning they don't take pleasure in hurting other people. One can have lack of empathy, but actually be a good person because they just know, and they aren't doing it to manipulate. They're doing it because they think it's the right thing to do, or they understand that it is the right thing to do. And I've worked with people with antisocial personality, and if there's a road forward, it often has to do with that. And the other thing about antisocial that is a misconception is that they don't have emotion. They might have attenuated emotion, but they have emotions. They're not an alien species. And so you can actually potentially engage their empathy by helping them to relate more. In some ways, for some people with antisocial or with psychopathy, it's an impairment that has nothing to do with any choice. I mean, their condition has nothing to do with a choice of theirs, but they, with some awareness and with a compassionate therapist that doesn't stigmatize them, they can be inspired to stretch themselves, to grow, and at the very least, to be a pro-social component of our society. But anyway, so I don't know how I responded, but I'm guessing it was something along those lines. And I probably also commiserated with the patron in that the misconceptions around personality disorders that I will hear in a university is appalling. It's one thing to not know something and to say, I don't know, as a professor. It's another thing to spout bullshit that you don't know anything about, which happens a lot. And I think it has to do with just misinformation, but also when you're a professor and you're insecure, you don't feel secure enough to say that you don't know things, and you're expected to know things. And if you don't know things, then people might demote you in terms of how they see you, or they might literally demote you on the org chart or fire you because you don't know things. So it can be an insecure thing. The thing that I'll put out there, I was thinking this the other day, just in my head, just daydreaming, or I don't know what you call it, but just thinking to myself, that therapists and professors are some of the most insecure people on the planet, partially because we're all insecure, but also because the responsibility and the tasks at hand are just so overwhelmingly complicated and difficult. If, it's sort of like asking, it's not the same, but it's sort of like asking a doctor, a physician, a medical professional to know everything about every medical condition. And I think most of us understand that when you have a broken bone, you go to a specific kind of physician. When you have a need for medication, psychiatric medication, you go to a different kind. And I think all of us understand that they don't understand each other's realm. They understand enough to know the basics, right? But they don't understand, the whole thing. And so in my field, we often are expected to know everything about everything. And we expect ourselves to know everything about everything. But that is impossible. And I think out of that insecurity, professors and other clinicians that are in a position of power, supervisors, will have a hard time admitting, even to themselves, that they don't understand everything. Anyway, and also people with antisocial personality disorder, there's no advocates, right? There's no all psychopaths' lives matter, psychopaths' lives matter hashtag, right? There's no movement, there's no spokesperson because of the stigma, which, I get, and so does the anonymous patron, in that there's a lot of suffering and a lot of crimes that are committed by people who are legitimately diagnosed with antisocial personality disorder, sometimes before, sometimes after the fact when they're in prison. And if you've ever interacted with someone with antisocial personality in your personal life, it can be really hurtful. It can be really, it can be abusive. It can be horrible. It could be violent. It could be all sorts of things. Having said that, not everyone with antisocial personality disorder is a problem to society. And there's a lot of people who lack empathy, who, they're not likely to be a psychopath, but they might, anyway. So I'm not going to go in the weeds again, but So I responded somewhere along those lines, and then the patron wrote in again and said the following. Hello, Kirk and Bob. And by the way, I decided to read this email in a solo episode because I have a lot of emails I want to read with Bob, and I was worried I would not be able to get to this, so I'm getting to it now. Okay, I'm going to read the second email. I am the antisocial middle tier patron who wrote into you in the episode Therapists Without Empathy. Oh, so I must have named the episode Therapists Without Empathy. I wanted to follow up and answer some of the questions that you and Bob posed. I have a deep admiration for your work, Kirk, and I have had a deep admiration for a long time now. First off, I want to commend you for your response. It's clear that you're very intelligent and open-minded. I also appreciated Bob's curiosity and sympathy. It's rare that people of his emotional caliber express such feelings towards people in my position. That's my nice way of saying that sensitive people usually hate psychopaths. As for the questions that you and Bob had for me, I will start by addressing the whole empathy thing. All right, so this is the bit that relates to the deep dive. And by the way, this email is what prompted me to do the deep dive from Monday because of what they're saying here. So to read what they're saying. To be completely honest, I don't really understand why empathy is a necessary prerequisite to being a good therapist. Okay, so if you remember, when last episode, the deep dive on empathy, we have to define what we mean by empathy, right? And I don't blame the patron for not defining it because I think what they are referring to is what is commonly referred to, which is the way it's referred to when it's said that people with antisocial lack empathy, right? It's, let's look at the typologies again. So we have one system where it's cognitive, emotional, and compassionate, right? So when people are suffering from antisocial, they typically will not have emotional or compassionate empathy, or they will have a very limited emotional and compassionate empathy. That will happen naturally, right? But they still could have cognitive empathy in that they can understand other people's perspectives and other people's emotions, because cognitive empathy is not just about emotions. It's about perspective and about thoughts. It's about understanding other people, where they're coming from, that kind of thing. You might not care where they're coming from, but you intellectually understand where they're coming from. And you might even understand how they got to that place, right? You might think it's reasonable that they got there. And I guess along these lines, I will often have this type of empathy when I'm watching a reality TV show and I'm watching someone do something that is what I would think to be destructive to themselves and others. So I'm not endorsing their behavior, but I have cognitive empathy because I have this conceptualization of how they got there that is logical. You know, there's a step-by-step process and internal defenses that need to be adopted in order for them to have that problem later. And so I get it, you know. Now, that also has to do with that other typology, which we might call this background empathy, or what I might call conceptualization empathy. But anyway, so for the typical antisocial person, they will not have emotional empathy because of, well, we don't know why, actually. And I'm going to get into the etiology when I do my deep dive on antisocial, but suffice to say, there's a lot of neurological theories and developmental theories as to why you would have an adult that would not have the capacity to feel other people's emotions as other people are feeling them. So, for example, when someone is crying or grieving, or when they're happy and laughing, for the typical person, they'll have a normal range of picking up the other person's emotions, sometimes involuntarily, and then vicariously feeling the emotions with the other person. Now, in reference to the last episode on empathy, that isn't necessarily compassionate empathy. You're just feeling someone else's emotions, right? So for non-psychopaths, there's a typical range of that emotional empathy that people will have. And there's also a typical range of compassionate empathy, or to have compassion, to care, to feel bad for someone, to feel motivated to help in some way. That's compassionate empathy. People with antisocial and psychopathy, they typically don't have much of that. It can be developed though. But anyway, so getting back to the email here. So they say, I don't really understand why empathy is a necessary prerequisite to being a good therapist. So if we look at that typology, this is me chiming in again, you don't need to have emotional, vicarious empathy, reactive empathy to someone else's emotions to be a good therapist. It can help in assessment, but it could also muddy the waters, right? Compassionate empathy is very helpful as a therapist, but in certain modes of therapy isn't necessary. Also, if you remember when I was going over the typologies of how empathy is framed within the field of psychotherapy, none of the three types that are delineated in the literature have to do with compassion or even vicarious empathy. So those, again, to remind you, you have empathic rapport, which is to show empathy or to empathize in a way that builds rapport. And then you have communicative empathy or process empathy, which is the Rogerian active listening, where it's not necessarily even about emotions, but it's about being interested in the client's perspective and their story and their lived experience. And you're just really attuned to what they're telling you and putting aside your own emotions. You're phenomenologically listening, and you're asking questions to encourage them to continue telling you their experience. And you're not interpreting, and you're not commenting or analyzing. You're just living in their shoes. Okay. So that's another type of empathy that's kind of specific, but very powerful. And then the third type in therapy that we talk about is what I was saying earlier about background empathy, or what I would call conceptualizing empathy, or conceptual empathy, in that you conceptualize a client in a way that might provoke empathy or caring or compassion because you can understand how they got to that place. So when it comes to when it comes to a therapist that has antisocial personality and doesn't have emotional or compassionate empathy, you can still show empathy because you would know intellectually from cognitive empathy what to reflect and what to say. And also the communicative attunement empathy or process empathy, this is purely motivated by the therapist's interest and their understanding that phenomenological listening and being curious can really, really help people. An antisocial person who is well trained doesn't need to have emotional empathy or compassionate empathy. It can help, for myself as a therapist, but also as a client. I like it when my therapist has compassion for me, you know what I mean? Or shows compassion. Anyway, so continuing with the email. So they say, I don't really understand why empathy is necessary to being a good therapist. Again, we have to define what type of empathy. Maybe that this is naive of me, but I find that even individuals with intact empathy often fail to understand their clients. Sometimes it seems as if it is their affective empathy, their emotional empathy, that leads them astray as they mistake their own experience for that of their clients. So just chiming in. Yeah, so this can happen. And I talked about this in the deep dive, that with emotional empathy, you are, to some extent, involuntarily just feeling the other person's feelings. Sometimes when you don't want to, and you might be feeling the feelings even out of your awareness, and that can be a good thing or a bad thing, and it definitely can cloud the judgment of the therapist. Now, a well-trained therapist, but also a therapist that's been through a lot of their own therapeutic work and has enough experience to do this kind of work, they will very quickly, in all likelihood, identify what kinds of vicarious emotions they're feeling through emotional attunement and emotional empathy, and they'll be able to manage it well enough. Managing one's countertransference is a very important part of effective therapy. And so there's that. But it can. And so for someone that doesn't have emotional empathy, what the anonymous patron is saying is that I don't have that risk. Okay, I don't have the good side of emotional empathy, but I also don't have the bad side of emotional empathy. And I think what anonymous patron is getting at is I don't need emotional empathy to have cognitive empathy or to show that I care, going on. I have found that my own personal therapists have done this with me, meaning that, they go on. They seem to superimpose their own feelings onto me when my reaction to a situation doesn't align with their own. All right, so let's drill down on this. So that is not that's not technically emotional empathy. For a therapist to superimpose their own feelings onto you, anonymous patron, that is by definition not empathetic. They are feeling a feeling, they're affected, they're having countertransference, but it is not indicative of them feeling your feelings. And their technically speaking, their countertransference has clouded their judgment and caused them to say things to you like, oh, I bet you feel this way, or you must feel this way. And you as a client, anonymous patron, are just like, actually, I don't feel that way. And okay, so moving on with the, but first let's take a break. All right, we're back from the break. So going on with the email, they say, I suppose it's a bit of a misnomer to say that I lack empathy. I don't experience effective empathy, meaning that I don't selflessly care about people and their emotions, and I'm not naturally inclined to picking up the other's feelings without sufficient motivation to pay attention. So let's chime in here. Let's use the typology that we identified in the last episode. So they're saying that they don't experience compassionate. So they say, I don't selflessly care about people and their emotions. So that's that compassion empathy. And they also say, I'm not naturally inclined to picking up on other people's feelings unless I really motivate myself to do so. So that is affective or emotional empathy. And so they're saying, I don't have that. But then going on with email, I do, however, have excellent cognitive empathy. Okay, just chiming in, meaning intellectual understanding or picking up on other people's experiences. This means that acting empathically is a choice for me, not a compulsory action that I feel emotionally forced to engage in. So just chiming in on that. And maybe I talked about this in the last episode about this, but when I first started out as a therapist, so I'll tell you what I was thinking when I was in graduate school. I noticed around me, and part of it had to do with actually watching Carl Rogers operate in some films and videos. I noticed or I wondered about myself if I actually had empathy in the way that we often talk about it, in that I wondered as a person and as a therapist if I was below average or just didn't even have the capacity to have that immediacy in terms of my care and my behavioral indications that I'm picking up on what other people are feeling and communicating care. The way that I framed it in my mind when I was 26 years old was a maternal energy. That's how I talked about it. That's how I thought about it. And I also thought about it as empathy. Now, I knew that I wasn't antisocial or a psychopath. I knew that I had compassion and care for others, but I was third out of 4 kids, and I'm this one way of describing it. Another way of describing it is for 7 years, I was the baby of the family. My older brother and sister are like 6-7 years older than me, so no one parentified me in the least. If anything, I was infantilized. I was not expected to care for anyone's feelings or to even do any chores. because my older brother and sister were taking care of all those kinds of things. And so I wasn't socialized as a young person to take care of other people. And I didn't have that natural, immediate sense of compassion and care for others, particularly in terms of the way I reacted physically, with my face and my voice and my body. I tended to be in my early, career, like at internship, I noticed that I was very good as a listener, and I was very good at interpreting and throwing things out there, asking questions. But I noticed that other therapists would very quickly have this emotional, physical response in their voice. They'd be like, "Oh my God, I'm so sorry that happened. Tell me more." There's a possibility that at the age of 26, I had literally never done that in my life. I mean, maybe, but it was not my role. I was a football player. I was a jock. I was a frat guy, literally. And people didn't come to me for that kind of stuff. So, and they didn't come to me for that kind of stuff because I didn't give a maternal energy to anyone. Now, did people cry on my shoulder, and did people tell me their feelings, and was I there for people? Yeah, but it wasn't my identity. People wouldn't have seen me that way. You know what I mean? But I also wasn't cold. You know what I'm saying? Anyway, so I actually wondered if I would ever be that kind of therapist, and it actually kind of worried me a little bit. And I believed that maybe there was a chance that I could develop that maternal energy. And so I set out to do it. And part of that actually was inspired by Carl Rogers when I would watch his demonstrations on film or TV. And I saw a role model because he's a man, but he also, he expresses empathy in a way that felt like something that was attainable for me, because it wasn't, I guess one could argue it wasn't maternal, it was more paternal. And we think of paternal as being a negative thing, but it's just being of the father, right? Or of the father energy. And of course, fathers can be compassionate, can be just as compassionate as mothers, right? But it's a different vibe if we're living in the confines within gender, expressions, masculinity. And so I'm just speaking off the top of my head, I haven't really thought about this sort of thing. I do know that when I saw Carl Rogers, I was inspired. I thought, that's what I want to do. I want to be like him. And I worked on it. And it was interesting because it was an emergence of a part of me. And fast forward 10 years and to today as well, which is 30 years later, I now have that automatic reaction to the point where it's annoying at times. I'll cry so easily, Now, I'm slowly learning to dismantle my taboo and my negative associations with crying, so that I'll just cry in front of people, even on this podcast, But it's not just about crying. It's about just the facial expressions that you have when people are talking about something intense, whether it's happy or sad. When I was younger, I would have been more blank-faced, if you will. But now I'm way more expressive, and it's not a put-on, it's not fake. It's something that I had to practice it's weird to say this, but it's like I developed a spontaneity, if that makes any sense, or I allowed myself to express my inner spontaneity. One of the things that's related to this is that when I was very young, like 2 or 3 years old, there's this famous story in my family, famous meaning, a story that often gets said at family gatherings as a kind of a funny anecdote, that my mom was taking a picture of me and she really wanted me to smile for the picture. And she's like, "Smile, Kirk." And I was quietly not smiling, and she's trying to get me to smile. And I'm still staring back at her, but I'm not saying anything. And she says, "Kirk, why aren't you smiling?" And I said, "I am smiling on the inside." And I really like that anecdote because it really fits with how I felt like I was, in that I had all the expressions and the spontaneity and the emotions. I just wasn't displaying them. I think partially because of that dynamic in my family, in which I was third for a long time. I was the baby for a long time. And my older brother and sister were very active. They were very, I don't know if extroverted is the word, but they had a lot of activity. And again, 6 or 7 years older than me, they were always more competent and more interesting and more cool and more social. And, and they had a lot of attention on them from extended family and teachers and the community and stuff. And I was just this quiet boy playing with Lego in the corner, literally. And I think what that developed in me was this kind of blank facedness that lasted into my adulthood. And I interpreted that as me not having maternal energy. I had maternal energy. I just wasn't used to manifesting it in the here and now and showing it on my body and in my face, that kind of stuff. On my face and my body. I sort of messed that up, I think. So for, now I'm not antisocial like the emailer, but it is kind of related, right? You can show empathy without feeling empathy. You could also feel compassion, empathy without showing it. Anyway, going on. Well, let's take a break. All right, we're back from the break. So I forget where I left off, but let's see. This means that acting empathically is a choice for me, not a compulsory action that I feel emotionally forced to engage in. I have excellent cognitive empathy. Although cognitive empathy is a skill that I've honed only relatively recently, it is a skill that I began practicing early in life, which is great because I can now apply this skill to making money. Okay, I may not be able to rely on emotional intuition as much as other clinicians, but I have my own set of techniques to circumvent negative therapeutic outcomes. Just chiming in. Now, I should mention that for some people, they might be terrified of working with a therapist who doesn't have empathy naturally, right? Doesn't have emotional or compassionate empathy. It could even feel dangerous to some people. And it could be said, or I shouldn't say it could. I imagine some people might think, oh, this anonymous patron is in it for the money. They're just trying to scam clients. They're going to try to trick them out of their money. They're not interested in helping, right? If they don't have compassion, empathy, how can you be a therapist? Why would you want to be a therapist if you didn't have not only just some compassion, empathy, but much more than average? I mean, isn't that the whole thing? Is that it's a calling and you're trying to give back, you're trying to help people. There's so many other things one can do. And it takes a lot of effort to become one of these professionals, the education and the trouble. And why would you do this? Are you trying to scam people? Are you trying to manipulate? What's the deal here? And yeah, I mean, all those things can be true, even if someone isn't antisocial. And so the question that I would have for this anonymous patron, and maybe I asked this, and because this email is longer, so maybe it gets into this, but the question would be, why do you want to be a therapist, or why do you want to be a clinician in mental health, if not for the natural compassion, empathy that so many of us clinicians have, and not only have, but we have a lot of, which is really motivating us to do this. What's the motivation? Why do you want to help these people exactly? Is it just for the money? And on one hand, that would be very concerning. On the other hand, it depends on outcomes. There's a possibility that even if someone was antisocial and they don't really care about their clients, but they do very much care about their finances, and they become very good as a clinician, as a person who shows empathy, as long as they're not lying, right? Because congruence is a very important, authenticity is important, and it can be crazy making to a client to hear the words of empathy but not really feel it. But as long as the anonymous patron sticks to cognitive empathy and phenomenological listening and active listening, the Carl Rogers deep way of listening, then it doesn't necessitate having compassion and empathy, and you're not expressing false indications of compassion and empathy, and it actually can be very, very helpful. So that is the question. Because if the answer is, well, I don't care about the clients, I just want to manipulate money out of them, then that's active. That's an active desire to hurt the clients. And people with antisocial personality disorder can engage in that, but it's not necessary. It's not necessarily true that people with antisocial endeavor to hurt people. So anyway, going on, anonymous patron, they write, I've always been an incredibly curious person, the type to just push buttons and see what happens in people. This curiosity helps me to avoid misunderstanding my client and comes through in my sessions in a very productive way. For example, one of my clients has been using our sessions to understand their feelings around a dying family member and their complicated relationship that they share. If I had the typical levels of empathy, I think meaning compassion, empathy, or emotional empathy, I might feel something like this, like maybe the client's grief or despair, meaning so the patron's saying I might actually feel the client's grief or despair. Instead, I find it intriguing, and so my experience of this client and their situation is highly cognitive. This might sound like a detriment to those who can't conceptualize lacking effective empathy, but it appears that my client actually benefits from this. I spend much of our session asking them questions that others probably wouldn't, partially because I genuinely don't understand their experience, but also in part because I want to examine their own understanding of thoughts, feelings, and reactions. So just chiming in. Yeah, so what the anonymous patron is describing is the type of empathy that is described as communicative attunement or process empathy, which is, so let's define that again. It's the active, immediate, in the now, moment-to-moment effort to stay attuned to the in-the-moment communication from the client by showing nonverbal and verbal indications that you're listening well. So in this definition, you don't hear that the therapist necessarily feels compassion or feels vicarious emotional empathy. It's, in a very simple way, an example of this is nodding your head as a therapist, like, oh, okay, I'm with you, and asking clarifying information like, okay, when you said that it made you feel this way, what did you mean by that? And I think what the anonymous patron is saying is that because they don't have empathy in terms of the emotional empathy, they can't relate, right? They don't really get what the person is feeling. They're purely thinking about it as a clinician in the intellectual sense, and they therefore don't have assumptions about what's going on in the client's life because they haven't been there themselves emotionally, and so they're compelled to ask more questions because they're genuinely curious, because they genuinely don't know what they mean when they say they had a grief reaction to their loved one, having a condition that will result in them dying at some point. And so like we say, what is that? So when you feel grief, what is that like for you? And for the person grieving, they might feel actually really heard. It can be ironic that when we have emotional empathy and a client tells me that they're grieving and I have emotional empathy and I feel that grief myself because I know what that feels like and I'm attuned to the client, then I might just move forward as if I get what they're feeling because I know that feeling, I'm having that feeling right now. But the client might actually notice that I'm doing that, or maybe not notice it consciously, but they might definitely notice that they feel more heard if I stop and say, internally, I say, I don't necessarily know what they're feeling. I have an idea, and I'm feeling this emotional empathy right now. I'm feeling with them right now. But that doesn't necessarily mean that I understand everything about or enough about their felt experience. And this is central to phenomenological listening, Carl Rogers and all that stuff, just really asking for more information. And it can, as I was saying in the deep dive on Monday, it can be really helpful to people to have those questions asked in that way. But going on with the email, I spend much of our session asking them questions that others probably wouldn't, partially because I genuinely don't understand their experience, but also in part because I want to examine their own understanding of their thoughts, feelings, and reactions. Because of the idiosyncrasy of my questions, my client has told me that they've had to consider things that they normally wouldn't, and they've spoken to how helpful this has been in learning about themselves and their feelings towards their family member. Just chiming in, yeah. So if the clinician here is getting good feedback and has good enough reason to believe that the client is benefiting, even though the topic and the presenting problem is very emotional, that says something, right? Okay, going on with the email, they write, in my personal life, my endeavors to quote unquote figure people out have apparently made those around me feel seen and understood, even if I don't actually care about the person or their feelings that I've come to learn about. That being said, I do find that my deficits in empathy present me with potentially unique challenges. For one, boredom is something that I can easily slip into when sitting with a client, as the client's emotional experience is often not enough to keep me fully invested. Just chiming in. Yeah, so there's another possibility, anonymous antisocial patron, that you have a bit of narcissism as well. I don't know if you mentioned that in your longer email, in that you are self-serving and a little selfish, and if the session isn't serving you, meaning that your curiosity isn't being engaged and satisfied, and there's and so you're outside of that space, then yeah, you might get bored and you might show that you don't care. You might even stop listening really to them, that kind of thing. And that is a challenge, and that is important to look at, right? And I will say that for myself, I don't experience that kind of boredom, at least very often. I mean, I can't remember the last time I felt that kind of boredom, maybe 10, 15 years ago, which has a large part to do with in my, the latter part of my career, I've had the ability to really work with the kinds of clients that I really want to work with, And in the beginning of my career, I didn't have that luxury. And so I would have some clients that really didn't want to be in therapy, and therefore sessions would be really boring because it's like pulling teeth or staring at the wall while they just avoid you. That could be really boring. But I don't feel boredom with clients that are there willingly. And I guess, and I hadn't really thought about it. So you emailed in this idea, but it is true that for me, I don't get bored because I care, because of my compassionate empathy, because as they're talking, and I'm just thinking about some clients that talk, not because they're narcissistic, but because they've just got a lot to get off their chest, and I'm not really involved much, but I'm on the edge of my seat because I care deeply and I worry about them, and I want them to feel heard, and I want them to feel better. It hurts me to learn that they're not doing well, and I'm like really activated by me helping them by just listening. And if my needs aren't being met, at least in the curiosity sense or in the self-centered sense, it doesn't matter. I am getting a need met because I have a need to take care of people, and I have a need for other people to be doing okay. You know what I mean? But yeah, I hadn't really thought about that. Because you think about it, it's like, well, how do you as a therapist just listen for hours at a time? And it's because you care in your heart, and if things are going even relatively well, minimally well, you can easily conceptualize your listening as being helpful, and by soothing, at the very least, soothing to them, validating, supporting them, but also potentially correcting for traumas and relational traumas and schemas that are an ongoing thorn in their side. But anyway, going on with the email. I don't care about people, at least not as human beings. I care about people as subjects to be studied or as tools for learning. It may be fair to say that I care about them in the way that you might care about a good book, a game, or a movie. I'm not sure that this type of care contributes to my experience of boredom with clients when I do not feel that the session is adequately stimulating. It's an issue that I'm actively working to better understand and resolve. Just chime in. Okay, well, that puts a fine point on it. You say that you don't care about people, you don't really care about them as humans. You care about them as subjects, objects to be studied or tools for learning. And you think about them in the way that one might think about a book or a game or a movie. They're kind of objectified in that way. And yeah, that certainly sounds like a lack of empathy, a lack of what they say, lack of empathy, a lack of care about other humans and what they're going through, right? And so it's, and it could, so the thing that I would normally say in a situation like this is you want to have a supervisor that can sift through all this and possibly, monitor you for suitability for this profession, because there is a risk here, and we can't necessarily depend on you to notice or even care if there is a risk there, right? As you might admit as well, But the problem is that to find, it might be hard to find a supervisor that is aware of antisocial personality enough to know that you're not automatically not a good candidate. So I don't know what to advise you to do. I guess I would try to look for someone that maybe a specialist and just hire them as a supplemental supervisor so that you could be honest with that person. Because I'm going to take a guess and say that your current supervisor, you're not telling them about this. I mean, you don't have to. It's your own private personality issue, but it does pertain, and it does need to be wrestled with, because you say it's an issue that you're actively working to better understand and resolve. Well, I don't know if it is resolvable, given what you're saying, because if push comes to shove, right, then what's going to happen? And a big part of what motivates us therapists to be ethical and to do selfless, like it's really common for therapists to not charge enough. Whenever I talk with my novice therapists in private practice, 99% of the time or 100% of the time, when they set their price, they undervalue themselves. And there's a lot of factors involved in that. But a big factor is that they just care about clients and they don't want to charge them too much. They don't want to be an inconvenience to the client. And that's, at least partially due to compassion and empathy. They want to help and they don't, and they want to be selfless, and they don't want to harm the client. And however much charging a client could harm them, they just don't want to do that. I'll put myself in that category. Even to this day, I'm charging less than what would be, I don't know what the average is, but for my experience level, I would say that I undercharge for sure. I mean, like Bob charges more than I do. He has the same amount of experience that I do. Anyway, so we're very now that, and that's a bad thing that I have to overcome. I have to tell people, look, you got bills to pay. You have a huge student loan you got to pay. The current pricing scheme that you have isn't sustainable. It's not going to work. So you're going to have to bump that up. You don't have to, but I recommend that you do. You're certainly worth it, and you'll find that a lot of people in Seattle will pay at least double what you're planning on charging. So, with therapists, typically when they are not antisocial, they are driven a lot by their compassion for their clients. For example, ethics, right? And other kinds of concerns that clients worry about, even though no one is watching them, even, once they're no longer under supervision and they're operating fully licensed, therapists police themselves. And I'm not saying you wouldn't do that, anonymous patron, but it is a question mark, right? If you don't care and you just see the clients as something that kind of serves your interests because you're curious and you're wanting to become a better therapist, will that ultimately keep you in line? I don't see any reason why it wouldn't. It very much could, right? I guess you would, if I were your supervisor, I'd ask you questions about other domains in your life. Like, you say you have friends, and are there instances where there's a conflict of interest where it would benefit you to screw over your friend in some way? And all you'd have to do is just lie or deceive or just lie by omission or, I don't know, do something behind someone's back. What is the thought process there? How do you navigate that? Do you just act on impulse, or do you stop and think? And this is the work I would do with people who had psychopathic traits, is what is the guiding force? Because if you don't have morality and compassion, there are other forces at play. There are other guides internally that we operate. For people, they typically assume that altruistic, pro-social, compassionate behavior that's done, it's, sort of like giving to charity without putting your name on it, giving to charity anonymously or something. Why would anyone ever do that? That doesn't serve them at all, right? They get nothing from it. Let's say it's not a tax break or something. Why would anyone do it? You're just throwing money away, right? Well, because people care. Now, there's other reasons why people do it. They'll do it out of guilt, social guilt or something. But a lot of times it's because people care. So what motivates you, anonymous patron, in situations like that? And other motivations can be things like, well, I understand this is the best thing to do. I know that this is what's ultimately best for humanity and for society. That's why I'm doing this. Or it gives me pleasure, it makes me feel good about myself to know that people see me as helpful or smart or able or effective, something like that. Or it just makes you money to be a better therapist, like it would hurt your checking account if you were to act unethically and get accused of it potentially, So I would look into that. All right, going on with the email. As I'm sure you can see, I was not motivated to go into the field by the prospect of helping people or bettering humanity. Oh, okay, so they're getting into it. My motivations might not be altruistic, but this does not mean that the outcome of my work will be any less beneficial to society. There are many aspects of the field that drew me to clinical psychology, but I will try to stick to the ones that seem most relevant to my psychological differences. Firstly, getting a doctorate in psychology allows me a high degree of freedom in career choice if I were in private practice, and the ability to open your own practice, set your own rates, and most importantly, set your own hours is very enticing. Having that sort of control over one's work life is a dream for someone who has difficulty adhering to the rules and hours set by others. Just chiming in. Yeah, there's some evidence that therapists, on average, are a little bit more psychopathic than the average person. Not that they lack empathy necessarily, but they're on the dimension that is not as concerned about other people's feelings and thoughts about their behavior. Like I'm on this spectrum actually. Like one of the things that one of the ways that this manifests is that when I was at the university, there would be this. We would always get like a new president, frequently we'd have a new president or new administrator, and they would say, okay, here's and to me, it just seemed like they were trying to justify their salary, and they would change everything. And they go, okay, there's this new form everyone has to fill out. And I would be one of the only people that would just not do it. So I'm just not going to do that. It's stupid. It doesn't make any sense. It's illogical. Now, sometimes they would implement new things that were necessary and I could get behind, or maybe I wasn't sure. But there were some things when I was sure that it was stupid and I just wouldn't do it, and I didn't care, and I didn't lose sleep about it. Whereas I would have colleagues, most of my colleagues, even though they agreed, they would still do it because they just had a really hard time breaking the rules. You know, it was an expectation. The guy up the org chart said to do it, and so they were going to do it. Now, having said all that, when I had a good leader, when I had a responsible, logical leader, I would follow them to the end of the earth. I wasn't opposed to being a subordinate. I liked being a subordinate. I didn't like being the boss when I became the boss. So I'm not saying I was defiant. It was more just I had an easy time just not going along with things that we all agreed were not logical. And so I noticed this difference between me. Another aspect was kind of getting at what Anonymous Patreon talked about is that when I was a teenager, I noticed that at parties, I would ask questions that other people would never ask. Not because I just wanted to be provocative, but because I just didn't care about social conventions about what you should and should not ask people. Now, God knows what I was asked. I can't really remember. I was 16, but I remember people would remark it. They would say, wow, you asked some really interesting questions. This is an interesting conversation. And we'd be just around the corner from the keg and people doing keg stands and people talking about inane sort of surface level stuff, and so now I'm not saying I'm some philosophical genius or anything. I'm just saying that I would want to ask a question just out of curiosity or making conversation. And internally, I wouldn't even note that this is not the sort of thing that you're supposed to ask. This is, at the very least, it's getting close to outside of the bounds of normal society. I didn't care about the bounds of normal society. And I think I also kind of attribute that to being half Japanese, is I noticed the hypocrisy in our society about culture and about rules and about societal norms. I just noticed, like, wait, so for white Americans, it's this way. For Japanese Americans, it's this other way. And there's racism. And anyway, so it can help, I think, to be a little bit naturally outside the realm of the compulsion to follow the rules and to be pro-social in that very rigid way. Because to be a therapist, I think it requires us to not care about social convention, about taboo subjects, and it can make us more comfortable about that kind of stuff. Going on with the email, I want to also stress that I've learned how to come across as a very warm person despite my internal separation from people. My colleagues have told me that I'm one of the most empathetic people that they know. And throughout my life, I have had more strangers feel comfortable enough to open up to me about their deepest secrets and traumas. My clients, as far as I'm aware, do not experience my deficit in affective empathy or emotional empathy. Many people don't until they actually get close to me. Oh, I see what they're... So they're saying that people don't notice that the anonymous patron doesn't have emotional empathy or compassionate empathy, but they do notice when they get close to them in relationships, right? All right, so just summarizing the rest of this email, they're saying that there's another reason why they want to be a therapist, and another reason that they think will keep them going and and being effective, being helpful as a therapist, in that they want to help other people who also have conditions and personality traits that the general public and maybe even other therapists don't tend to understand. And to that, I would say, yeah, I think that could be a good thing. Maybe even specifically working with people with antisocial or people that are identified as being at least somewhat psychopathic. You might be of great help to them. Absolutely. All right. Well, that does it for that episode of Psychology Seattle. Everyone out there, please take care of yourself because you deserve it. You really, really do.